As new cases of COVID-19 continue to rise in the Amarillo area, the worry of exhausting resources grows. Part of those resources is healthcare workers.
If everybody can just walk into an ICU that are taking care of COVID, I think reality would hit you really hard. The more patients we lose, the more defeated that you feel. It's not a typical flu that we're fighting. This is definitely something more severe, more extreme, and it's exhausting.
Soria says her and her team started off strong in March, but 7 months later, the demand is wearing on them.
You have to build yourself up before you come to work because you have to anticipate the worst, because that's just our reality right now. Our reality is that we're losing 6 people in 2 days.
Building yourself up only to feel exhausted at the end of the day.
You leave work and you're exhausted because it is a different type of patient that you're taking care of. It is physically a lot more taxing on your body than it would be to take care of any other patient.
Soria says when patients get bad, they're flipped on their stomachs, something that takes 6 nurses to do. But now running low on nurses is a new worry.
We're opening our second ICU as we speak of COVID. We've filled up completely one of our units, especially in healthcare. We don't have an unlimited number of people. When we exhaust our resources, what would we do? And I think that's where we're at right now, is we are exhausting a lot of our resources.
And Northwest isn't the only hospital with this issue.
Just because we have those ventilators doesn't mean that we have the staff and the physicians to manage patients if we were at 100%.
Soria says some nurses haven't seen their families in months, while others are battling cancer as they continue to care for COVID-19 patients. From a healthcare perspective, she says it can be frustrating making these sacrifices only to see people out in public not wearing a mask. Reporting live in the studio, Elisa Miller, News Channel 10.